hearing from first responders again. I kind of steer away from frontline workers, but I'm talking about fire, EMS, and police. And obviously, we're going to have some of the same concerns we had in the spring about acquisition of PPE, and then staffing. Should we run into situations where there are outbreaks within a department, et cetera, and how they should handle that, and how PEMA is helping them navigate through some of these challenges. So I know you had done a lot of stuff in the spring, but talk about how you're helping this particular group gear up for this fall resurgence.
So they're all good questions. So just a few things on the personal protective equipment front. We've done a lot of things in the early part of the pandemic that are actually paying dividends now. So we continue to build a state stockpile, and that is available obviously to first responders. We want, we're aware of a number of counties that are doing the same thing. So as the supply chain comes back online, we've been able to acquire PPE. We still have concern, obviously, because we don't know how big the fall resurgence is going to be. And there's a big difference between using an N95 a week, an N95 for a day, and an N95 per patient, which is actually the gold standard. So we still continue to acquire the PPE. Ultimately, what it comes down to is if there are unmet needs, there's a process to be able to go through, especially for the first responder community, to be able to gain PPE. Some of the counties that we're aware of have started projects with their first responders to be able to provide PPE, or at least have a cache if they run short. Same thing there. If the county doesn't have that cache, they have the ability to be able to come to us, and we have the ability to be able to get PPE to them. And we can usually turn that around in about the same day, or the next day at the latest, to be able to get those commodities shipped. From a staffing perspective, we monitor that. So, one of the things that's concerning for us, obviously, is like the 911 center. So, we have a 911 office, and we have the ability, there's a couple of different tools we have in our toolbox if we see specific sectors of public safety that are impacted. And we saw some of this in the collar counties in the beginning part of the pandemic. And there is mutual aid that they can use. There are pre-existing relationships right now within counties, within regional task forces. If it rises to a level that they would need state assistance, we can broker that state assistance. And that may be moving individuals from one county to another county to cover functions. And there is a vehicle to be able to do that through the Pennsylvania Intrastate Mutual Aid System. That can, incorporate exchange of funds for providing those people for that time, or it doesn't necessarily have to. So that's really a brokered conversation that we have the ability to be able to have at our level between the entities that need support and the entities that have available support to provide.
I mean, fair to say you think we're in a much better place now than we were in the spring?
You mean well, it depends on how how you phrase that. I think from a PPE perspective, I think we're in a little better place where we were. I think from a, combating the pandemic perspective, I think we know a lot more about the virus now than what we did in the spring. I think the hospital systems, and I don't want to talk on behalf of the Department of Health, but I know that many of the healthcare systems have taken a look at their surge capability, and they've built additional surge capability. And I think, the therapeutics that are out there and everything else, and how they're taking care of COVID patients has improved drastically since the beginning of the pandemic. So I think all of that is working in our favor. However, the challenge is that as we have more disease transmission throughout the community, it becomes more challenging because it affects then every component of the community, including the healthcare spectrum and everything else. And that's the concern.
Are there things that maybe you can, even outside of PPE, equip EMS crews with, or even firefighters, police, so that, maybe if they get somewhere and, someone has let the virus prolong within their body for an extended period of time, that you can help, medicinally or otherwise? I mean, are there things that, advances in treatment that have, helped in such a way that, you can almost tackle it right out the gate if you know that there is a potential for whatever this person is afflicted with could potentially be COVID-19?
From a first responder perspective, I don't think we're there quite yet. I think the evolution of medicine has been really centered around the hospital setting right now. And I think a lot of it is just like any other respiratory, syndrome, it's really the supportive care and the first responders that are in the field, the EMS providers and firefighters that may respond to, these situations, and law enforcement, they have the ability right now to be able to support the people to get them to where the care is. And that's really key. So I think the biggest thing is really equipping folks with the knowledge to be able to protect themselves and to limit the virus transmission. And the first, the frontline workers and the EMS providers that are out there is really making sure that they have that knowledge. There are a lot of novel concepts on decontamination of ambulances. We know some of the counties that, purchased equipment to be able to do that, so that when they come to the hospital, they can decontaminate the ambulance interior with vaporous hydrogen peroxide and those types of things. So that's really a novel way of looking at it to, again, stem the virus transmission and make sure that there's a safe environment in the back of that ambulance to care for anybody and to make sure that the providers are safe.
Has PEMA really stressed the importance of these men and women, the ones on the front lines, really following the guidelines that are set forth for the rest of us? I mean, I feel like it's almost got to be more critical for them to avoid gatherings and to wear masks when they're out in public, or even when they're at work with one another, because like you said, if you get some kind of outbreak or ripple through, a police department, say, you could have a real problem. So has PEMA kind of been influential in maybe really trying to educate these groups in particular about, the importance of making sure that they're, taking the proper precautions?
So, our reach out or our outreach, obviously, to the community usually goes through the emergency managers in the counties. And the emergency managers have those connections with their local law enforcement, fire, and emergency medical services personnel. So we push regular messages out to them. We reinforce that. We have, briefing calls with the counties, especially if there's things or items of concern that come up, to be able to pass that information on. And we are always constantly amplifying the Department of Health's messages, related to first responders and first responder community. We have a very good working relationship with the Department of Health. Their Bureau of EMS is actually housed in their office is housed here in our agency headquarters. So we work with them on a regular basis. And it's really getting that knowledge out and really reinforcing that so they understand the importance of keeping themselves safe and also protecting their families and their loved ones.